Hello, Dr. Mark Dailey here. On the last video we mentioned that gluten sensitivity causes inflammation, and that inflammation causes disruption of our digestive system and our immune system as well. Another avenue through which subclinical gluten intolerance affects the immune system is through the inflammatory response. Many people have heard of corticosteroid medications like prednisone or cortisone. They're used for a wide variety of medical purposes. Corticosteroid injections are used for muscle injuries to reduce pain or joint injuries. Corticosteroid sprays and inhalers are used by people who suffer from asthma and allergies to improve function of the airways. Our bodies make its own corticosteroid, the most abundant of which is the hormone cortisol, and I'm sure you've heard of that. With chronic low-grade inflammation from gluten intolerance, or for that matter, any stress that inflames the digestive tract, our body produces increased levels of cortisol. Since cortisol is also one of the major modulators of the immune function, this suppression of our immune system can cause a variety of other problems. As a matter of interest, this immune-suppressing role of corticosteroids is used in medications in certain circumstances when immune suppression is actually the goal. With organ transplants, for instance, and in some serious autoimmune diseases, corticosteroids are used therapeutically to suppress immune function. However, in other situations, this immune-suppressing role of cortisol and corticosteroid medications work against our health. When cortisol production becomes abnormal, our hormonal and immune systems are without question affected. While elevated cortisol suppresses our immune system or our immune response, it also causes a catabolic breakdown state that exists in our bodies, and symptoms of adrenal exhaustion will eventually appear, like fatigue, depression, loss of libido or sexual desire, allergies, and frequent illnesses. There are also many connections between subclinical gluten intolerance and other intestinal problems. To describe this connection in a little more detail, we'll review the structures and functions of the small intestines. The small intestine is constructed like a tube. The inside of the tube is the healthy mucosal lining, or it's supposed to be. Mucosal tissue also line the sinus pathways, the lungs, the urogenital tract, the mouth, and the throat. These lining tissues act as vital barriers to defend the body from infectious organisms. The small intestinal lining tissues also perform the critical function of absorption of nutrients. Now, under chronic inflammatory stress, this healthy mucosal tissue breaks down and a condition called increased permeability, also known as leaky gut syndrome, occurs. Leaky gut syndrome refers to the loss of the integrity of this mucosal or lining tissue. Having leaky gut syndrome is like having a screen door with large holes that allow flies and other insects to get through. With leaky gut syndrome, the lining of your intestine becomes overly permeable, and molecules that were not intended to cross the blood barrier, or that mucosal barrier, or into the bloodstream enter, or leak in, if you will. This leads to a great deal of immune stress as your body tries to handle all of these uninvited guests. Now, gluten reactions also cause other problems. There are structures called lacteals that are located in the very tips of the villi, which can be destroyed by reactions to gluten. These lacteals are responsible for helping in the absorption of fats by breaking them down into very fine droplets. If this process is compromised, it can result in poor absorption of healthy fats that are critical to your health. This depletes the body's source of fat-soluble nutrients, leading to essential and essential is essential for a purpose, right? You can't live without it. Fatty acid deficiencies, low levels of vitamin A and vitamin E. So even if you're taking supplements, the full benefit of fat-soluble nutrients won't be realized. Deficiencies of these nutrients depletes nutrients critical for the function of every single cell in your body and negatively affects blood sugar control, nerve cell function, steroid hormone production, antioxidant formation, and many other processes. It is also common for people with subclinical gluten intolerance to develop blood sugar problems, sometimes referred to as Syndrome X or metabolic syndrome. On the next video, we're going to talk about nutritional deficiencies associated with subclinical gluten intolerance. Thanks for your time and attention.